Your next speaker, Daniel Jones. Mr. Jones will be followed by Linda Bates and William Hopkins.
Good morning. I'm Dr. Dan Jones. I live at 9904 Winding Ridge in the Lake Highlands community of Dallas. I'm a faculty member at Texas A&M University Baylor College of Dentistry, and I've been teaching and practicing dentistry in Texas for the past 30 years. I'm here to speak in favor of keeping fluoride in our public water supply. I'm not going to give you my whole life story, but I will say I was born here in Dallas, but I grew up in Central Texas on a farm. Dental care was not the highest priority in my family, but we had regular checkups. But the most important thing related to my dental health was that from my formative years through high school, the water I drank came from the well on our farm that had no fluoride in it. So I have a mouthful of fillings and crowns. I'd like you to contrast that with the case of my 3 sons who grew up in San Antonio at a time when that city did not have fluoride in its water. But I made certain from the time that they were babies until the time that they went off to college and we lost complete control of them, that they got fluoride supplements each day. So the punchline there is that now amongst all 3 of them, there's not a single cavity or a filling. For the past 15 years, I've been working here in Dallas to provide dental care for our residents that lack the money or the resources or access to dental care. Every year we're at the Mayor's Back to School Fair seeing those children. I want you to take a look at the school children behind me today and understand that dental pain, dental complaints are one of the top reasons for public school absences in the DISD and in the nation. Parkland Hospital will tell you that dental complaints are the #2 reason that people show up in their COPC clinics. It's also among the top 10 reasons that people show up in the emergency departments in our hospitals. Closer to home, every day as I come to work, I see a line of patients that have formed outside the dental school, some of whom have been there since 3 a.m., so that they can be one of the limited number of patients that we see in our emergency clinic each day. If the fluoride is removed from our water, the people that are aware and have the resources will get fluoride supplements like I did. But what about the people that we are serving that don't have that knowledge and don't have that access? As healthcare providers for this population, we know that 80% of dental problems are in 20% of the population, the poorest and the least well-educated. Where will these people go for this treatment? Taking fluoride out will take away the most cost-effective, the most effective means that we have for preventing dental decay. So I would ask that if you consider the issue of fluoride in our water, that you take into account the proven safety record and balance the undeniable benefits against a relatively small financial cost. Thank you for your time and attention.
Thank you, Dr. Jones. Thank you.
Your next speaker, Linda.
Excuse me.
I'm sorry.
Mr. Atkins first.
Mr. Jones, I really appreciate you coming down here to speak about, dental care. I travel all over the country, and in most countries you see, which you do not have fluorides in the water, you see the care of the dental problem. And I wish to say they do understand that dental is very important, to our youth and to the citizen here. And sometimes people do not have fluorides, another option. So thank you for coming down, and colleagues, I believe that fluoride should stay in the water. Whatever we need to do, we should make sure that there's, because it is a health issue. And if your teeth are not great, your body's not good. So just remember that. Thank you.
Thank you. Ms. Gates.
Thank you. And I, too, just want to thank you for coming down. We've been hearing from the opposition, and I appreciate you sharing your views of the positive side of fluoride in our water. And I, too, am supportive of continuing to add fluoride. I know the CDC recognizes it as one of the top 10 public health initiatives. So I'm proud that the City of Dallas has been part of that. So thank you.
Thank you. Mr. Cadane.
Thank you, Mr. Mayor. Well, I appreciate you coming down, Doctor. And I will continue to look at the problem of fluoride. I've got many articles speaking against fluoride and that it does not help. And I heard that you mentioned one of our main concerns in the city is kids, is folks complaining about dental problems. We've got all these dental problems. How did the fluoride help them? So I don't see that fluoride is the problem one way or another with our dental problems. And I will continue to research this and make sure we do make the right vote on fluoride or not fluoride. Thank you, Mr. Mayor.
Thank you, Mr. Cadane. Next speaker.